Welcome back to another episode of Health Law Pulse. I'm your host, Jonathan Rhodes, healthcare attorney and founder of Health Law Counsel, LLC. Today's episode tackles something we don't talk about nearly enough in compliance conversations: politics. Not politics in the legislative sense, but the internal politics of healthcare organizations, the relationships, incentives, personalities, and pressures that ultimately determine whether compliance succeeds or fails. My guest today is Jay Anstine, healthcare compliance leader, educator, and author of Navigating the Politics of Healthcare. Jay has spent years advising healthcare organizations on compliance strategy, governance, and risk management, and he teaches extensively on how influence and communication shape effective compliance programs. What makes Jay's perspective especially compelling is that he focuses not just on the regulations, not just on the rules, but on the human dynamics that determine whether organizations actually follow them. In my experience, most compliance breakdowns aren't caused by a lack of knowledge, they're caused by a lack of alignment. In this episode, we talk about what separates effective compliance leaders from those who struggle to gain traction, how to secure real buy-in from leadership, early warning signs of program weakness, and what emerging risks healthcare leaders should be paying attention to right now. If you've ever wondered why technically sound compliance programs still fail, or how to make yours more effective, this conversation is for you. This is Health Law Pulse. All right, Jay, welcome to Health Law Pulse. I appreciate you carving out some time to meet with us and talk a little bit about compliance. Appreciate your time today.
Yeah, thanks, John. Appreciate the opportunity.
Yeah, absolutely. Absolutely. So, Jay, I like to start with just asking a little bit about your background. We'll get into that in some of the questions that I have, but just if you could just give us a brief background. I know you've spent your career in compliance. What got you into your career? What is sort of, what do you do now, and what's kept you in career or kept you in compliance for all these years?
Yeah, no, great question. So just a little bit of background on me. Lawyer by training, but I've predominantly spent my time in the compliance area. I got into healthcare back in 1999, originally working in managed care, and then switched over to legal and public policy and a couple other places. And then I finally um, maybe found my home, for lack of a better term, with compliance back in 2005. I had a relocation out to Denver, Colorado. And at the time, I was planning to sit for the Colorado bar, and I just wanted to work inside of healthcare organizations for a few years and then practice. And then as I started working in compliance about a year in or so, I just decided I really liked it. And I like the investigations, I like the education, I like the kind of proactive nature of the work. I think that's probably what's kept me doing it and kept me engaged with it. And over the course of the last 20 plus years, I've largely worked in and around health systems. Did spend some time with some physician owned entities and on the managed care side, but predominantly it's been spent in and around hospitals and health systems, working on a number of different compliance issues.
Excellent. Great. Thanks for sharing that. And so you're a recovering lawyer who's found a home in,
Yes,
and
yes.
you made it out. I haven't made it out.
Yeah.
So
Yes,
congratulations.
yes, yes.
So it's nice on the other side.
Yeah, I think, to me, I think it was just a better fit. I certainly spent a number of years working, reading bond documents and drafting contracts and things like that. And I did like the work. I really did like the work, but it just, for some reason, and maybe it was the educational component of it, there was just something about, um, delivering education and training. The regulations always changing, having to get out in front of that, and then on the investigation side, just kind of digging into issues that were always kind of unique to work on. For some reason, those two things, I think, largely is what kept me in compliance. So.
Excellent. Excellent. Well, that's fantastic. And we'll get into a little bit about what you've done over the last 20 plus years, I guess, in this field. Certainly appreciate your expertise as we dive through some different topics related to healthcare compliance. And Jay, just to start off, one thing I've learned in my career, it's not easy to navigate competing priorities. I've talked about this in other other episodes, where you're sitting in a boardroom, or you're sitting in a conference room, and you've got compliance, you've got legal, you've got clinical leadership, you've got business, different priorities, different personalities, different incentives inside the same organization. You spent a lot of time thinking about that side of healthcare. I mean, in fact, you wrote a book about the politics of healthcare. In fact, the name is Navigating the Politics of Healthcare, a compliance officer's guide to communication, relationships, and gaining buy-in. And I think that's a topic that doesn't get nearly enough attention because compliance, love to get your thoughts on this. Compliance lives or dies based on influence, not just analysis. I think maybe explain a little bit about your experience where, at least in my experience, having the winning analysis isn't necessarily going to win the day, or isn't necessarily going to win over all those competing interests. And so why in your opinion is politics such a defining factor in whether compliance in a healthcare organization succeeds or fails?
Yeah, no, that's a great question. I think just a little bit of background on kind of that topic, and I agree with you on it being sort of not talked about enough. And I'll definitely wrap around to the answer to your question. The the book idea came from a time when I was working for a physician-owned entity, and I was working for essentially a bunch of different physician owners, and there was also a hospital owner, and there was a lot of areas where there was disagreement. And then I was kind of stuck in the middle of how to navigate the compliance program through that and get, to your point, everybody kind of aligned because everybody's got different interests that are competing.
Right.
And that was sort of where the idea for the book came from. I think this is an area that I've identified over the years has been near and dear to my heart. I, I just sort of looking back over my career realized that I benefited very early on from being in a hospital or a health system CEO's office working on issues when I was in legal and working with executives and things like that. And very early on, I learned what to say and what not to say if I wanted to get leadership engaged to compliance and how to do that effectively. And so, to me, the soft skills is really an important part of being an effective compliance officer and the success of the program. And as you had mentioned, yes, having the technical skills or the ability to do the analysis is great. They can get you in the room, but if you want to stay in the room, you really do have to have the ability to know how to influence others in making those decisions. And I think it's an area where compliance really can tap into that as an asset,
Mhm.
because a lot of times compliance officer isn't at that executive level, or they are reporting to those executives or the board or whatever, so they might not necessarily have the highest level of authority. So the way you kind of work around that is having a really solid ability to influence others and making the right decision for the organization.
Yeah, that's interesting. And so that brings up an interesting dynamic, right? Because sometimes you will be a compliance officer may be in the same room as the CEO or senior vice president on the business or the clinical leadership side,
Mhm.
and the compliance professional is not necessarily at that title level. So you mentioned, the way to get around that is to kind of have these soft skills, the ability to persuade. What does that look like in practical terms? How does one, if I'm a new compliance professional and I'm in this room and I'm very intimidated
Yeah.
by the level of professionals in the room, which to be totally transparent, I've been that person, not on the compliance side, but
Well,
on
me
the
too.
legal side as a brand new lawyer,
Yeah.
being in a room, it's fairly intimidating. So how does one get past that dynamic and be able to persuade others, or at least help, whether they agree or not, help those professionals, those senior level leaders, to at least see your side of the argument or your reasoning in coming to some decision on some compliance issue?
Yeah, no, that's a great question. And I think it really is a lot of stuff that I at least had picked up over the years, that kind of where I was able to figure out what was working and what wasn't working. And I think, to your point, it's a lot of stuff that the newer folks just starting out don't know because they just haven't experienced or haven't figured it out yet, which was a large reason why I wrote the book. And I've got a separate course that talks about that, as well as more just soft skills type things. And the idea was to try and cut down on some of that learning curve that you have as you're entering into, this type of work or practicing law. But to answer your question, really the biggest overarching strategy that has helped me over the years has been having this mindset of functioning like a business partner or advisor, if you want to use that term, to those senior leaders or executives or department directors versus an obstacle. And kind of what I mean by that, to clarify that point, is the more that they see you acting like them in terms of how they're making decisions or how they're interacting with others, that will put you in a better position where they will eventually over time not see you as that obstacle. They will see you as somebody that is out looking out for their best interest to try and make sure they make the best decision. You're not there to slow down progress and things like that.
Right.
And so what that looks like, just to give some kind of finer point or examples with it, is doing things like anticipating questions you're going to get asked. So if I'm going to go in and have a discussion with a hospital CEO or CFO about a potential repayment to Medicare, then I know, for example, they're going to ask me that, how did this issue come up? What are we doing to prevent this from happening again? How much money do we have to pay back? How long does this go back? I mean, there's just sort of some kind of basic factual questions, but it's better to be prepared with answers to questions you're likely going to get asked. Now, you might not have the answers to every question or anticipate every question. That's certainly understandable. But I think there are some baseline ones that you can have an answer to that if you do, that makes the discussion go a lot more smoothly and a lot more efficiently versus scrambling and going, well, I don't know. We haven't figured that out yet. I'm going to have to look into that and get back to you. And then that's sort of operating inefficiently. So things like that, like anticipating the questions they're going to get asked, is one. Another one that I've coached a lot of compliance officers with over the years is if they're coming to you with a business proposal, hey, we want to do this deal, can we do it? No should be the last words out of your mouth, not the first words, is what I usually say. Or if you're going to use no as the first words, you're going to say, no, but what if we did it this way? Or something like that. Or what I typically tell a lot of newer compliance officers is say maybe with a question mark, which is not saying yes and it's not saying no. It's just saying I'm going to roll my sleeves up. I'm going to look into this and see if I can figure out a way that we can make this work that's going to be business friendly and compliant, so we can both have a win and move forward. And when you, I think, take that approach versus just saying, no, we can't do this and I'm not going to look into this and that's the end of the discussion, that um, typically sends the wrong message to leaders and they start to not trust you.
Yeah, that's a great point. So you and I have both worked with a lot of early career lawyers, early career compliance professionals. One thing that I've seen repeatedly is that they are very a lot of them are very smart. A lot of those that I've worked with are extremely bright. They're technically very very strong.
Yeah.
In influencing leadership is a completely different skill set, which is what I'm gleaning from your commentary. Knowing the rule, getting an organization to act on it are two very different things. So,
Mhm.
as many of us have learned, simply saying, well, the rule is this, therefore we have to do it. The regulation says this, we have to do it. It's rarely a winning persuasion strategy.
Yeah. Right. Right. Right.
Yeah.
Right.
And you mentioned your course, the course called How to Successfully Sell Compliance to Healthcare Leaders, which is really kind of on point with what I'm talking about. And so, for, we talked about this a little bit, but is the biggest mistake new compliance professionals make when trying to influence leadership? Is it, just based on your response to the last question, is it sort of easily getting into that rut of becoming the what I call the department of no? The rule says this, therefore that we have to do this, as opposed and therefore maybe being perceived as, even if that's not your intent, being perceived as an obstacle as opposed to a facilitator. Is that the biggest mistake the new compliance professionals make, or is there something other than that, or bigger than that we're missing?
Yeah, no, I think that's an example for sure. I was gonna say maybe as an overarching thing or a theme would be just sort of lacking self-awareness
Mm,
about how they're communicating, how the message is landing, knowing your audience, things like that. I think that's probably the biggest area where I see newer compliance officers error, and it's not a fault of their own, it's just lack of experience is what I would say. To give kind of another example of what I was talking about earlier with the influencing and acting like a business partner, I use that example of the repayment with Medicare and the CFO and the CEO. Another thing for functioning like a business partner and demonstrates the self awareness as well is if I'm going to go into a CEO or an executive director's office and say, hey, we have this repayment to Medicare because we used the wrong code or something like that. I know this very likely that CEO or executive director is going to say, have you talked to the CFO about this?
mm,
Or what was the CFO's position on this? Or what was their input or insight? And So either two things need to happen. Either I need to make sure the CFO is invited to that discussion so we're both talking about it, or I need to be prepared with the answer to that question.
Right.
And that's demonstrating anticipating questions. But the other thing for operating like a business partner is you're showing or demonstrating that you know how decisions are made in the organization, which is that CEO or executive director is not going to make a decision until they've got input from that CFO. So when you can function like that and have more self-awareness around that, I think those types of things help. So I think for those newer folks, it is a lot of just sort of lack of self-awareness about knowing their audience. Another example of that is, and this I am very guilty of this, or was when I first started out, and that was, hey, I've been through law school. I know the regulations inside and out, up and down. I'm going to dazzle them with what I know, and they're just going to magically agree with me, or I'm not going to get any pushback. And I was completely wrong on that, and got a lot of pushback. And uh, sometimes professional words were said, and sometimes unprofessional words were
Right.
said. But it was a learning moment for sure, and I realized kind of what not to do in the future, and those kinds of things. So,
Yeah, that's an interesting point. And so I've been in situations as well where I like your repayment
mhm,
example. That's a good one because there's a lot of dollars at stake, right? Sometimes, and let's say you have a just hypothetically proposal to repay $2 million to some government agency because of you did the look back, you've gone back 6 years, you've done the investigation, you determined that something was billed incorrectly, and there's this refund amount. But anticipating the questions they're going to be asked is a great piece of advice, and really having your ducks in a row in terms of the analysis. Okay, so we used the wrong code to bill. What's the code description? And when you have that many dollars at stake, I think one thing that you can easily anticipate is that they're going to try to poke holes in it, not because they want to do something nefarious, only but
yeah,
because they want to make sure that it's legitimate, that you're right, that there isn't
yeah.
uh, some legal or compliance reasoning to be able to hold on to those funds. And so having those ducks in a row, I think, is really really important. I think that's a great piece of advice.
Yeah, and I think, the other thing too is that this was something I didn't realize early on either, that I did over the years, was that, and this kind of goes back to my self-awareness or knowing your audience pieces, you have to kind of be, as much as you can, try and put yourself in the position of that person you're talking to and explain we have an issue. They might have a reporting obligation. Like, for example, I mentioned the CEO earlier in that repayment. Now, if it's significant enough, like you were talking about, some of those dollars, that CEO is probably going to have to report that out to the board, or there's going to have to be a report out of that information, and he or she's going to want to know the facts around it, what they're doing to prevent it, because they're going to get asked those questions too. And so sometimes some of that pushback is from that perspective of just making sure they understand the facts, and making sure that they've got answers to questions where board members might be trying to poke holes too. So,
Yep. Yep. Absolutely. Absolutely. Okay. So Jay, let's talk about buy-in. When I a previous job I worked at, when I think about buy-in, for some reason, this was the first thought that comes to my mind. This is not a compliance example, but one of the business leaders came in. We had this kind of senior leader meeting, and he came in with an oar, and sort of acted out rowing a boat. And his point was, we all got to be rowing in the same direction.
yeah.
And his point was, we all need to be buying into the business objectives of the organization, what our goals are, what we're trying to accomplish. Um, it's kind of a funny way to demonstrate that, but buy-in is one of those terms that gets used constantly in leadership meetings, healthcare leadership meetings, but we don't always stop to define what it really means in practice. And let me just offer up my opinion and get your thoughts on what it means. From a legal and compliance perspective, buy-in to me isn't just agreement, it's ownership. It's when leaders start thinking about risk the same way compliance does, even when no one's in the room reminding them. And I think the trust piece is really important. You talk about gaining buy-in in your book.
Uh-huh.
What does gaining buy-in actually look like in the real world, and not just in theory?
Yeah. No, that's a great question. I think, a few things at least to me is what it means is definitely the ownership, like you had mentioned, and making sure that everybody is, as you said, rowing kind of in the same direction. And I think what that looks like from a realistic or real example standpoint would be once you've got buy-in, for example, one way that could be demonstrated from leadership is that they're proactively reaching out to you with questions or concerns. And that is going to happen after you've established that trust with them rather than reactively. And a lot of times that reactive is because they're not quite sure how you're going to respond. Are you going to look out for their best interests? Are you going to slap their hand or play gotcha or do something that's going to embarrass them? Those are, I think, sometimes some of the anxiety that goes along with some of the leadership roles where they're a little more reluctant to engage compliance because they're just not quite sure how you're going to respond. So if you've developed that trust, that breaks that barrier down. And so to me, buy-in would be, yeah, that proactive reaching out with questions or concerns or kind of example I'd mentioned earlier of, hey, we want to do this business deal with this other hospital or this other healthcare organization or physician practice or whatever. Is this something we can do or we want to share this information? How do we do it without getting in trouble?
Right.
When they're asking those types of questions and they're reaching out to you proactively, that's a very good sign of having buy-in. The other thing is sort of how they speak about compliance is another example of buy-in too when you're not in the room. So is it, are you hearing things like compliance made me do this or hey, you should check with compliance on this to make sure we're okay. Those are kind of two opposite end spectrums where the latter would be more of a sign of buy-in. Again, when they're starting to see you as that sort of trusted advisor, that typically would be how do you demonstrate buy-in.
Yeah, that's good. So, talking about this concept of trusted advisor is something I think a lot about in my own work. Legal and compliance teams have a choice in how they're perceived. And we've talked a little bit about this, sometimes by design, sometimes by accident. What separates compliance leaders who are trusted advisors from those who are seen as obstacles? And we're kind of dancing around the same topic, but is it really just gaining that trust in actual practice? What does that look like? Is it again, go back to the example of a new compliance professional? How do I gain the trust of a senior vice president who has been working at this healthcare organization for 30 years, and I am a second year compliance professional? How does one practically do that? Become that trusted advisor?
Yeah, so I think there's a couple different ways that you can do that, and sort of I'll give you a couple of examples that I think draw that distinction between the advisor versus like a rule enforcer or Department of No type person or something like
Mhm.
that. One, I mean, I think all these boil down to kind of how you interact and how you communicate with those leaders. But some examples of that, I mentioned obviously the earlier example of no should be the last word out of your mouth, not the first word. That would be one. Avoiding jumping to conclusions is another one. That's one I've seen with a lot of early career compliance officers where they've only got a limited set of facts so far, and they've already jumped to a conclusion that everybody's going to jail or there's going to be huge penalties, and then they paint this picture that the sky is falling when they don't have all the facts yet and they haven't quite understood things. So just slowing down and making sure you're going through that process of gathering the facts and then seeing kind of where it goes and avoiding that tendency to try and draw a conclusion until you've got all the facts and circumstances. Because there are some situations where once you start to learn more, well, this is how it was initially reported to me, but then once I talked to these 4 or 5 other people, I found out that necessarily it wasn't completely the right story or it wasn't completely accurate. There's
Mhm.
another piece to this. Um, uh, and so I kind of this goes along with it, but another area where I see, early career folks kind of stumble is what I think of, and I comment about this in the book too, is sort of assuming bad intent. So what I always say is assume neutral intent until your facts prove otherwise.
Yeah.
It sort of goes along with that jumping to conclusions. Like it's I think a natural human instinct to cast some type of judgment that if a leader did something they weren't supposed to, that there was some type of malintent there, which may or may not be the case. And you don't want to assume that from the beginning again until you've got facts that might establish that. That could be a different story. But you want to at least maintain a neutral intent, which isn't saying positive intent, but it's not saying negative. You're just trying to keep an objective point of view until you've got all your facts assembled, and then you're able to more um, comprehensively come to a conclusion.
Yeah, those are great points. Ideally, compliance. Thinking about this concept of effective compliance programs and in developing these relationships and credibility and trust long before any disciplinary process is involved. Ideally, compliance is like a referee throwing flags and more like a coach who helps the team to avoid penalties in the first place. We live in Colorado.
Mhm.
Pro Bowl offensive tackle Garrett Bowles, who, by the way, is from my hometown of Lehigh,
Oh, yeah.
Absolutely. But early in his career, he was constantly scrutinized for false starts, false start, false start, false start. Now he's a Pro Bowl offensive tackle. Kind of the same thing, right? And a lot of that has to do with coaching and trying to help the player or in this case the business organization avoid those penalties, be proactive. I love your comment about objectivity and not assuming bad intent, but being thorough in fact gathering, being thorough in your analysis before you present something. Because if
Yeah.
you're not, absolutely, it's easy to jump down this road of assumptions and jumping to conclusions and things like that. Very, very important.
Yeah, the other thing is, a big picture. That's sort of the other way to me, there's a distinction between trust advisor versus a rule enforcer approach, which is having a big picture approach to what you're doing, and that is being able to see a beginning, a middle, and end to an investigation, for
Yep.
example. And so a lot of times when leaders come to you, they are vulnerable. There is some anxiety that, oh, we screwed up or this has created risk towards the organization and things like that. And they are a little anxious about that piece of it. And so they're wanting some certainty with how they're going to get the organization back to a stable place again. And so
Mhm.
if you can have that mindset before you even start working on the investigation of what this is going to look like from beginning, middle, and end, not necessarily you're going to know exactly how it's going to go, but at least you've got an idea of, again, what the steps are to investigate, what the steps are to correct this issue that happened, and then also what steps are you going to take to make sure it doesn't happen in the future. And being guided by those is, to me, having more of a big picture approach. And that I think is a big distinction between trusted advisor and sort of rule enforcer.
Yeah, no, that's an excellent point. Having that macro perspective as opposed to living in the moment of the circumstances. I think that's really important. Jay, one of the realities of healthcare compliance is I'm sure you can attest to this. The problems rarely appear overnight. I know
Yeah.
it seems that way for us, the legal compliance folks, where an issue is brought to us and it's seemingly overnight. Everything, the walls are crumbling down and
Yeah.
everything is terrible. But they're usually there are warning signs, small inconsistencies, unanswered questions, gaps in communication or policies that showed up long before anything becomes an investigation or an audit. It's a bit like hearing a strange noise in your car. You can ignore it for a while. Eventually, it gets more expensive. That is an example that is very near and dear to my heart. As having a child who, as a teenager, several years ago, was famous in my house for this. Engine light would be on, weird noises, smoke coming out of the engine. Putting diesel fuel in a car and there are warning signs where that's just a terrible idea, but you keep on driving and it gets significantly worse.
Yeah.
They're all signs of something is wrong and will get worse if it's ignored. What are the early signs in your experience that a compliance program just isn't as effective as leadership believes it might be?
That's a great question. I think the example you had described, I was kind of thinking about this from a healthcare organizational perspective. I think that is a good example of a situation where it might not be as effective as you think it is that situation where leadership, department director, whatever, they're trying to figure out and solve their own problem before telling you. And then they get to a point where they can't figure it out. And then it that comes to you, so that it probably had been building or going on for several months until it got to you. So to me, that's a big sort of warning sign of not having as an effective compliance program as you would think, which gets again to what we were talking about earlier with making sure that you're taking steps to proactively develop those stronger relationships so that they are more proactively reporting issues into you. I think that's a big indicator. Another one, early warning sign, and some of these you could probably dive into some data analytics around, but if if you're sending out training emails, or which I wouldn't necessarily um, advocate for. I do more of it in person, but depending on the circumstances, if you're sending out emails about some type of communication and you need them to read, are they reading them? Are they actually being opened? Are you getting questions? Are you not getting questions? Or is there something a communication you sent out and then you don't hear anything back from them, and then a couple months goes by and then they're saying, well, I have no idea what you're talking about. Which again, I tend to look more at that from the angle of the compliance side, and are they doing their job in effectively communicating, more so than I would say, well, that it's that leadership's fault for not opening that email or something like that. The other thing I coach a lot of new compliance officers on quite a bit is that, and probably the same with in your line of work too, it's we know the rules very well. We don't, and our audience doesn't know them as well, or they don't know compliance concepts as well as we do. And so a lot of times you have to take things and sort of, either you call it dumb it down or just connect the dots, use examples that are going to relate to their line of work, things like that, to make sure they understand what this regulatory language actually means instead of some complicated words on a piece of paper. And there are certain topics, HIPAA and TALA, Stark, non-monetary comp gifts, where you just have to communicate all the time. It's just, that's the nature of it. New directors come and go. They don't know the rules as well. They don't know you know, how whatever they're doing relates to some of these things. And so there are just certain topics where you have to communicate quite a bit about, or it's going to be in one year out the other, or you might have to take a different approach in how you communicate. So a lot of those things I tend to look at as signs of how effective a compliance program is, how effectively are they communicating, taking into account some of those circumstances with their audience.
Yeah, no, that's excellent advice. Yeah, Jay, that's very helpful. So as I think about, I've been just taking some notes here. I think there's some great takeaways for myself. In terms of takeaways, and I'm kind of looking at this through the lens of a brand new compliance professional, or someone who doesn't have an enormous amount of experience in this space. As I think about what it means to get buy-in or become a trusted advisor, or sort of resolving for that dynamic of being a fairly new compliance professional in the same room as a 20, 30-year senior vice president or CEO. Some of the takeaways for me, which I think are really great: objectivity, I think, is super, super important. You are there, and this is true in the legal lane as well. I mean, you're there gathering facts, right? You are a fact gatherer, and then you can perform an analysis based on those facts. A thorough analysis, I love, and that really is along the same lines as jumping to conclusions. I can't think of another way to destroy credibility and trust faster than not performing a thorough analysis and bringing an issue. I mean, go back to the repayment issue, and you're proposing to repay an enormous amount of money to some government agency or some commercial payer without having done a thorough analysis and just saying, yeah, we got to do this, and come to find out we don't have to do it, or it's very low risk scenario, or I mean, it's not an overpayment at all. And what reason would be, and I'm not saying that can't be rebuilt, but it would take some time to rebuild that trust. So being thorough in analysis, not jumping to conclusions, being a facilitator. I love that. Being a facilitator, not just outright saying no, we can't do that. Again, I've said this on other episodes. There are very few things. There are some things, but there are very few things that in my 20-year career I've heard that I just said, "Hey, there's no way we can do that." Yeah. There may be some high risk scenarios or high risk proposals, and then I view my job as someone who is supposed to be there to help mitigate that risk. And maybe there aren't great ways to mitigate that risk, in which case it becomes an educational event. And we train and educate and say, hey, these are the reasons why this is high risk, and there's really no great way to mitigate that risk. But approaching it that way, as opposed to saying, no, we can't do this,
Yep.
is I think is a way to gain that trust. And you touched on that, which I think is great. Thorough communication is one that you just mentioned, which I think is really, really important. Anticipating questions. I love that. And that goes along with being thorough in our analysis, but anticipating those questions. Some compliance issue came up. How are we going to prevent this from going in the future? What does that analysis look like? What are the rules?
Mhm.
What are all the facts? Have we analyzed all the facts? Have we talked to all the people that we need to? And I think those are all really great takeaways. Jay, before I get to the last point, anything else that I missed or something that is really important that you want to make sure people take away from this conversation?
Um, actually, just a couple things as you were talking. On the thorough analysis, something if this is helpful for newer compliance officers because they may be thinking, well, that in and of itself is something I'm going to struggle with. How do I get around that? Is I would say as you're building your case or as you're gathering your facts and you're working through it, if you've got a memo or some type of other communication that you need to send out, is just get another set of eyes on it from somebody you trust, which most times is going to be your supervisor,
Hmm.
and have them poke holes in it internally because they're probably going to see something you haven't seen yet and or a gap in your analysis and then which is possibly a gap that's going to get asked by a leader, but if you can get that plugged up first before you externally send it out, that can help. So that's something I've done over the years. I still do to this day. If it's a super important communication needs to go out, I make sure I get another set of eyes like, hey, does this read right? Is there something missing? Are there any questions as you read this that you don't think I've addressed? Those kinds of things I think has been helpful in my career, and that's not something I knew, when I started out. I just kind of picked it up over the years.
Yeah, that is a great tip. That is so important because we all view things a little bit differently, and getting someone else's eyes on something. Yeah, we could be doing this for 10, 15, 20, 30, 40 years, and we're still not going to see things the same way. So getting another set of eyes on an analysis or a communication, a training, whatever the case may be,
Yeah,
is critical. I think that's a great piece of advice.
yeah.
Well, Jay, I'm gonna get you on this. So the quick lightning round. I got just three quick questions for you,
Okay.
and want to get your quick thoughts on these. So, first, what's one risk area that organizations consistently underestimate? Healthcare organizations.
There's 2 actually I can think of.
Okay.
So, and I don't know if this is too technical or not, but in our current state of things, open payments, I probably would say is the number
Okay.
one that jumps out to me where I think it's still relatively young, but we're seeing it enforced more and more. We're seeing the government using the data from the open payments database as they are doing investigations related to kickbacks and Stark violations and things like that. And I think that's a big one that tends to go under the radar where people
Right.
just aren't looking at as closely as they could. On the sort of hospital health system side, or if you're on the side that the recipient of something of value that's given to a teaching physician or a hospital or physician, or excuse me, teaching hospital or physician or the other qualified individuals, you don't have the penalty side of it. That's more on the manufacturers and pharmaceutical companies and the give what I think of as like the gift givers. But even going through the database and seeing what is out there still might raise some red flags as to a large speaking fee that a particular physician is getting or something like that, and maybe it's something you need to look at just to make sure you don't run afoul of any fraud, abuse concerns, and things like
Mhm.
that. But I think as an industry, that's one I see that I don't think gets looked into enough, and I think we're gonna see it more and more, and the government I know for a long time, it was sort of assumed that they were looking at the database, but then a few years ago, I can't remember what year it was, but it was during COVID, and they came out with a fraud alert on paid speakerships, and they flat out said that they're looking at the database. So I think
Sure.
that's something just to be mindful of, whether or not you're giving those things or you're just happen to be affiliated with a physician or another recipient.
Okay. Excellent. And Jay, we've mentioned you've been in healthcare compliance for over 20 years. What's changed over that time the most in how organizations approach risk?
Yeah, I think that's a great question because I think despite what we were talking about or have been talking about so far, that probably is the biggest thing that I have seen change over the years is leadership's acceptance of compliance and things like that as a business partner. It's much better than it used to be when I first started out. And I think it is more and more the needle is moving in that direction of seeing compliance as what I would consider as a strategic business advantage. Um, and what I mean by that is if you've got compliance engaged early as you're looking at deals or transactions or things like that, it helps avoid potential repayments down the road or contracts that have to be unwound or things like that. And I've messaged quite a bit to leaders over the years is sort of think of us like a GPS system. We are here to get you to your destination on time, so you don't go 10 miles, out of the wrong direction. So
Right.
So that's probably the biggest thing I think I've seen as it relates to risk is more of an embracing of compliance as a way to help reduce the risk within the organization, and then knowing that risk assessment and risk mitigation just is part of the business.
Perfect. So last one, and your answer to this may be the same as to the first question, but what emerging, if you look into your crystal ball, what emerging risks should healthcare leaders be paying attention to right now?
I think certainly AI is probably the number one that jumps out. I am not an AI expert by any stretch of the imagination, and I know there's benefits to it. I know there are risks and concerns around it. There are ways that I know it can be helpful, with medical record documentation and things like that. Also, auditing, putting together contracts, things like that. There are some advantages with using it, but there obviously are going to be some bad actors out there using it as well. And I think that's one of the biggest areas where I think we, as an industry, are just not educated enough on it. And I think a lot of us have kind of stuck our head in the sand about it, but it's just not going away, and it's something I think we're going to have to embrace.
Yeah, Jay, that was going to be my response to that question as well. I had the benefit of thinking about this a little bit, but AI and data, data has totally changed, I think, how government audits are done. AI is certainly contributing to that now. There's a lot more insight
Yeah.
into payment behavior, into billing behavior. That's largely contributed to access and the ability to analyze data. But you're right. So AI, you think about some of the emerging AI technologies in the healthcare space. There's a lot of it. I'm not saying it's bad. I think it's great for healthcare, but it's new. Just because of that, it's a risk, and it feels like governance regulations they tend to be a couple steps behind technology, and rightfully so, because technology is advancing at such a quick pace, much faster than legislative bodies can keep up with. So I totally agree with that. So no, that's a great point. Jay, this has been awesome. Great takeaways. I hope everyone got as great benefit out of this conversation as I did. So that's it today for this episode of Health Law Pulse. Our main goal is to just not put you to sleep unless you're trying to listen to this to get to sleep and you're having a tough time with that. Can you believe, Jay, that some people find this stuff boring? I mean, I get this from my kids all the time. It's just
Yep, I
it
know.
shocks me. It shocks me. But thank you for tuning in. You can learn more about Jay's online courses at bluebirdhealth.com, which is also where you can pick up his book. If you enjoyed it, if you enjoyed today's episode, subscribe, leave a review, share it with a friend. We are on YouTube, Spotify, Apple Podcasts. You can also find links to these episodes on my website at www.healthlawcouncil.com. We'll be back soon with more conversations at the intersection of healthcare, law, technology, and leadership. Thank you very much. Take care. Thank you for joining us today on the Health Law Pulse. This podcast has been brought to you by Health Law Council LLC, a healthcare law firm you can rely on. For more information about the services offered by Health Law Council LLC, visit www.healthlawcouncil.com, or you can email me at john@healthlawcouncil.com.